And just a quick disclaimer that this is, of course, only educational and not considered medical advice. So before you make any changes for you or your loved one, definitely talk to your doctor first. But how does the healthy brain work? So I'm going to just do a very simplistic overview of how the brain and how each area of the brain controls a different function and how this will relate to dementia. So in red, pink here, I depicted the frontal lobe, which is responsible for our executive function, problem solving, our ability to plan and organize, our memory retrieval, our expressive language, as well as motor skills, behavior, and emotional control. In yellow, I have the parietal lobe, which is responsible for touch, integration of the senses, math, reading, knowing right from left, our body orientation, and spatial awareness. In the back, we have the occipital lobe, here represented in purple, which is responsible for visual processing, depth and color perception, object and face recognition. And then in green, the temporal lobe, which is responsible for auditory processing, behavior as well, memory learning, and understanding language. And then we also have in orange, the cerebellum, which controls our balance, coordination of movement, and also cognitive and affective control. And finally, the brainstem is where all our automatic functions come from, like breathing, consciousness, blood pressure, heart rate, body temperature, digestion, and sleep control. And so cognitive symptoms are caused when there's dysfunction in particular brain regions, right? And so when we know the specific brain regions affected, that can help us figure out the cause. So for example, Alzheimer's disease, we know affects the temporal and parietal lobes early. And so that's why people for early symptoms tend to have problems with learning new information as well as orientation in their environment. So now let's go through the difference between normal aging and dementia. There's many changes that occur with just normal aging. Anatomically and physiologically, some of the changes include decreased brain volume, so brain shrinkage, especially in the frontal and temporal lobes, decreased blood flow to the brain, and increased inflammation. And then cognitive changes that are in the normal aging category include less attention, less ability to multitask, and slower speed of thinking. But there are certain cognitive skills that are preserved even with normal aging. And so that would be skills, overlearned knowledge, our vocabulary, and our memory for faces. So when we're talking about dementia, we're specifically not talking about just a normal part of aging. Dementia means that there's a decline in memory and other areas of cognitive function that are outside outside of normal aging, and those declines are interfering with independence. So dementia, though, is not a disease itself or an inevitable condition of growing older. And although it's very common, and the most recent estimates are that the lifetime risk of dementia after 55 years old is 42%, it's unfortunately very common, but it's not normal, a part of normal aging. And so in this table, I'm going to go through the different cognitive domains and how the symptoms may appear in somebody with normal aging as opposed to someone who has dementia from various causes. So, for example, when we're talking about memory, it could be normal to occasionally forget names or appointments or details or occasionally misplace an item, but it's not normal for a person to not be able to learn and retain new information or to be quite repetitive with questions or to accuse other people of stealing misplaced items. For orientation, again, normal aging would be if you occasionally forget the date or day of the week or get mixed up in an unfamiliar environment. But abnormal, and in the dementia, the category of dementia from various causes, a person may lose track of the month or season or get lost in a familiar environment. For language, a person can occasionally have word finding difficulty and feel like the words on the tip of their tongue and, maybe it comes back to them later. That's very different from a person who's having difficulty holding a conversation, having trouble with simple words, maybe saying a word that's not actually a real word because they've substituted letters by accident, or a person who's lost the meaning of words. For judgment, it's normal to occasionally make a bad decision, but to have frequent poor judgment or regular falling for scams and have a decline in hygiene would all be in the abnormal category. And then for performing familiar tasks, occasionally missing a monthly payment or struggling to learn new technology, and especially in someone who's never been tech savvy, those may all be part of normal aging. But with dementia, instead, you may be seeing forgetting familiar recipes, not being able to operate household appliances anymore, unable to manage a budget, and losing learned skills. And so again, the distinction needs to be made between decline and dysfunction because, as I mentioned, things can decline with normal aging, but it's not normal to have a new dysfunction, a new inability to take care of oneself. And the way we tend to measure the ability to care for oneself is with what's called instrumentals activities of daily living, the IADLs and ADLs. So part of a dementia evaluation includes making sure that the doctor's gone over whether the memory loss and other cognitive or behavioral symptoms are leading to an impairment in the usual function. So in a person with a mild stage of dementia, they may have struggle with the IADLs. So those would be things like managing the finances, remembering to take medications without reminders, driving safely, preparing meals and shopping. But in someone with a worse stage, for example, moderate or beyond, that's when the activities of daily living, the ADLs, can become affected. And those would be like the morning routine type things, like bathing and showering, dressing, transferring in and out of a chair or bed, having accidents, or being able to feed oneself. So what are the common causes of dementia? Well, again, if you're thinking of dementia as a fruit, your goal is to clarify what fruit are we dealing with. Alzheimer's, an apple, vascular dementia, an orange, and so on. So here I have an abbreviated list of possible causes of dementia, and I'm going to highlight these for a few, just these. So Alzheimer's disease, number one, to talk about because it's the most common cause. Up to 80% of cases of dementia may be from Alzheimer's disease, but it tends to not be Alzheimer's disease alone. What I've referenced here is pure. So maybe only half of dementia patients are, the cause is from pure Alzheimer's disease. It's commonly combined with another cause, and that other cause tends to be vascular dementia. Vascular dementia is the second most common pure cause. And when it's mixed with Alzheimer's, we call that mixed dementia. And up to 40% of cases of dementia can be from that combination of Alzheimer's and vascular. I wanted to highlight dementia with Lewy bodies because that's the second most common neurodegenerative cause of dementia. And frontotemporal degeneration, another one important to recognize because that's the most common cause when you're looking at people just under 60 years old. And then normal pressure hydrocephalus, not so common in general, but important to highlight as a cause of dementia because that people with that reason for dementia may be eligible for surgical treatment. And so, the crux of this is, why is it important to know the cause of dementia? And it's because some causes of dementia may require treatment. So there are medical conditions that can be the primary cause for a person's dementia, or at least a contributing cause. And so diseases of the thyroid or vitamin deficiencies, autoimmune disease, these are all things that should be looked for because, again, it may be the only cause for dementia or at least a secondary cause that requires treatment. Mood disorders like depression can cause dementia. Normal pressure hydrocephalus, I already mentioned, is one of the few causes of dementia that you actually may warrant surgery for and can be reversible. Future strokes can be prevented with treatment if a person has vascular dementia. So that's also very important to clarify. And of course, the big problem is that for the neurodegenerative causes of dementia, and by that I mean Alzheimer's disease and frontotemporal dementia, dementia with Lewy bodies, all these neurodegenerative causes of dementia, there's no cure yet. But disease-modifying therapies are available now for Alzheimer's disease, at least, and there are symptomatic treatments available for some causes, and those that should be. And the treatment for one cause of dementia is not the same as for all. So it's important to clarify which cause so you know that you're using medication appropriately. And again, even though there's only usually one main cause, there are usually multiple contributing factors, and each of those factors may be treatable. So you should never assume that the person's dementia is untreatable. So who do you go to for evaluation? There's many doctors that could evaluate dementia. In the category of primary care doctor, an internist or family physician, and the most specialized in that category would be a geriatrician. Psychiatrists may see people for dementia, and among those may be a general psychiatrist or geriatric psychiatrist, and then even maybe more specialized for dementia would be a neuropsychiatrist in that category. And then, of course, neurologists see people for dementia, and that may be a general neurologist or a behavioral neurologist like myself, which would be the more specialized for dementia diagnosis. And I list neuropsychologists here, but because they're often on the team used for evaluating patients for dementia, but they're not medical doctors. So, what would be the goals of a comprehensive dementia evaluation? Well, again, you want to uncover the specific cause or causes for the symptoms and detect any reversible causes. If not reversible causes, then at least find treatable causes. And to create a comprehensive management plan, even if the cause isn't reversible or treatable, but that you'd be able to optimize safety and quality of life and to plan ahead. So the pillars of a workup include history and physical exam, cognitive testing, lab work, and brain imaging. And so I'm going to go through a little more detail each of these. So first, for history and physical exam, this would be when you go into the doctor's office, right? What you would find is the person's going to do a detailed review of current memory and cognitive symptoms with the goal of figuring out, even just during that conversation, do these symptoms sound like normal aging or do they seem like they're in the abnormal category? And if in abnormal category, what type of dementia does it sound like it matches with, right? During the physical exam and also just in the interview, the goal is to clarify if there are anything that sounds or looks like physical symptoms that could match with Parkinson's like symptoms, which we call Parkinsonism, because there's certain dementias that could have Parkinsonism associated with it, but not others. So that's a helpful clue. There'll also be a review of whether there are any associated mood, behavioral, or personality changes, because some types of dementia can cause those symptoms early. And also, of course, because maybe it's depression or anxiety mimicking a neurodegenerative dementia, and therefore treatment would be helpful. And in general, of course, you want to address the needs of the whole person and help improve quality of life. Sleep habits should also be reviewed. There may be an undiagnosed or undertreated sleep disorder that could worsen symptoms. And there are some sleep disorders that are associated with certain types of dementia. So that's another type of clue for what disease you might be dealing with. Former and current substance abuse is helpful to review because smoking, alcohol, and recreational drugs all can alter the brain. And if the dementia symptoms are due to active substance use, then stopping the use can actually improve the symptoms. And a review of medical and surgical history is also, of course, very helpful because there's many medical conditions, as I referenced earlier, that are risk factors for dementia or can mimic neurodegenerative dementia. And surgery and general anesthesia in many people could be a cognitive turning point. Medication review is really important because many drugs, unfortunately, can cause cognitive symptoms, including those that are used to treat overactive bladder, over-the-counter sleeping pills that have Benadryl, pills that we call anticholinergic in that category, many pills that are used for pain, like in the opioid category, and then many medicines used for treating mood, including benzodiazepines. All of these can contribute to cognitive symptoms. So the next part in the evaluation would be the actual cognitive testing. And we would divide testing into two general categories. There's screening testing and then neuropsychological testing. And so screening testing is what the medical doctor would do during the office visit, right? So those are either brief pen and paper tests or in some cases computerized tests during the doctor's visit. And the depth of the tools depends on how specialized the doctor is. So internist may do a 5-minute screening test, whereas a general neurologist might do a 15-minute screening test. Whereas when I do an evaluation, it's more like 45 or 60 minutes of screening tests. And the usefulness depends on how well the person administering the test can interpret the results. Some people need neuropsychological testing, and that's administered and interpreted by a neuropsychologist. And that's different. So this is much more quantitative. It's usually a few hours of testing. The person's answers are normed for their age and education level. And this is extremely helpful when you're trying to clarify if the person has normal aging or not, or if maybe they have depression and anxiety as opposed to a neurodegenerative disease. And when a person's in an early stage of dementia and you're trying to differentiate between the different diseases that may be causing it. It's not usually used in moderate or advanced stages of dementia. And the results of the testing are sent to the doctor that referred you. And the doctor who referred should be able to reconcile the symptoms with those results so that a diagnosis can be finalized. Lab work and brain imaging are the final parts of the comprehensive dementia evaluation. And we do lab work in order usually to rule out contributors, whether primary or secondary to the condition. So things like, blood counts, liver, kidney function, various vitamin levels, thyroid markers, infection markers. And then imaging, when we're looking at structure and function of the brain. So a structural brain imaging test would be an MRI, ideally, as opposed to a CAT scan, and MRI is better. And then the function of the brain very often is also a test used in dementia differentiation, and that would be something called an FDG PET scan. And now more recently, there's disease biomarkers available, mostly for Alzheimer's disease and not the other causes for dementia. And for those we use in certain circumstances. And disease biomarkers we have in the categories of blood tests, imaging, even spinal fluid, and now a skin biopsy, which is more for the Parkinsonian-related dementias. So you go and get all these tests, and then what should you expect to be told, right? So when you're getting a comprehensive dementia evaluation, the goal is to hear, are the symptoms consistent with dementia? And if yes, then what is the cause, or what are the causes for it? What stage is it? Mild, moderate, or severe? And what other conditions could be making it worse, right? In the categories of mood and sleep and blood pressure, cholesterol, diabetes, all these other conditions that also affect heart can affect brain. And then what, right? So there's so many things that a comprehensive evaluation, you should get out of that conversation. So once you know the type of dementia, here's a list of the things that kind of would come from that, right? So you want to find out, are there FDA-approved drugs available for this type of dementia? And if so, are the risks in that particular person worth the potential benefits? Especially with the new Alzheimer's disease infusions that are available, it's important to really clarify, is it right for that person in terms of do they have the correct disease and stage? And then beyond that, is there a higher risk of side effect in that person? And so you could only figure that out in a comprehensive evaluation. Are there medicines or supplements that can improve the cognitive, behavioral, and or psychiatric symptoms, even if they're not disease modifying, right? Should we be avoiding certain medications? Should we be enrolling in a clinical trial? What new symptoms should we expect sooner rather than later? What would life be like later in the disease, and how can we prepare for that? Are there lifestyle changes that could help? And I'm going to go over a whole list of those in the coming slides. What supportive therapies could help, like psychological, physical, occupational, speech, language, swallow therapy, art, music, right? There's a whole host of therapies. Which doctors and providers should be on the care team? What safety measures should we be taking? Are there best communication practices that could help mood and behavior? What caregiver support services and community programs and resources should we pursue? And I have a shout out to Laya with that. And then how else can we plan ahead in terms of living arrangements and financial decisions and general decision making and all of that? So these are all issues that should be discussed as part of getting an evaluation to figure out, yes, it's dementia, but what's causing it, and now what do we do? And again, so now what if you figure out the cause, but there's no drug treatment available, right? But again, no drug treatment is not the same as not having a management plan. And as new disease modifying therapies become available or recommended, you have to know the diagnosis to know if it's relevant to you. Diagnostic clarity allows for planning ahead, proper expectation management, anticipatory guidance, and documentation for benefits and services. And there's a long list of contributing conditions and factors that can be optimized to help the symptoms and the course of the disease. So that's what I'm going to go over now. the long list, the lifestyle and other changes that can help improve brain health. And these are relevant for people who are looking to prevent dementia, as well as those looking to slow progression of disease in the context of dementia. So the first aspect I'll talk about, physical exercise. Very important for decreasing neurodegenerative processes and increasing neuroprotective effects in the brain. In terms of prevention, actually greater physical activity in midlife and later life has been associated with lower risk of Alzheimer's disease specifically, as well as all-cause dementia. But even in those who are already affected, aerobic exercise is important because it's been associated with better performance on cognitive testing, larger brain volume, specifically in the hippocampus, which is the area affected early in Alzheimer's disease. It can improve the blood vessel health in the brain, or decrease disease, the blood vessels, and lowers the risk of mild cognitive impairment and dementia. And then when you think about step counting, that also might be helpful. So with aerobic exercise, we think, 30 minutes a day, 5 days a week, that's kind of the optimal amount. But in a person maybe where that might be too much to ask, and we're just looking at walking, right? You could monitor steps, because even as few as about 4,000 steps a day has been associated with lower mortality. And in people who are at risk for symptomatic Alzheimer's disease, so people were tested who did have a positive amyloid in the brain, but did not yet have symptoms, walking over 5,000 steps a day slowed the accumulation of tau pathology, one of the proteins associated with Alzheimer's, and it slowed the cognitive and functional decline in those people. So exercise, very important. Mental exercise, also very important, right? The greater cognitive stimulation is associated with less accumulation of one of those proteins responsible for Alzheimer's disease, amyloid. And continued mental stimulation helps create new neuronal connections that offset the neurodegeneration. So thinking about what a person's old hobbies were that maybe they dropped when they stopped having time, and trying to pick them back up again, or finding a new hobby that they'd be interested in. Music engages various brain regions, including those involved in memory, motor function, and emotion. And so specifically, if you listen to songs from that you used to like as a kid, that could increase attention, alertness, and engagement, and can trigger autobiographical memories and emotional responses. Could also improve anxiety, depression, agitation, restlessness, and reduce stress. And musical training can lead to functional and structural brain changes and improve processing speed, working memory, and executive function. And in the prevention category, listening to music and playing an instrument have been associated with lower dementia risk. So figuring out a way to incorporate music every day would be great, whether that's just listening to 20 minutes of songs from the genre that was a favorite in the morning, or if the person were so inclined, maybe even starting up lessons again of an instrument that the person used to play. Social engagement, really important. Social isolation and feeling lonely, both separately, are risk factors for dementia, and in those with dementia have been associated with worse cognitive performance. So really important to figure out ways to get active and connected. And I list dance here because dance is a 4-in-1 activity. So if you're looking to add one new activity to, the weekly calendar that would be efficient, you get those four things I just mentioned in the one activity. So dance combines physical exercise, mental exercise when you're with a partner and you have to anticipate what the steps are going to be and remember your own steps, listening to music, and of course the social piece. So joining a dance class would be a great way to kind of do all of that in one shot. In terms of apps, in a person who where it wouldn't be frustrating and they're capable of doing an app, right? The one that actually has data behind it is Brain HQ. Specifically, a processing speed game within that app has shown in a long-term study showed that improved instrumental activities of daily living, meaning that after only a few weeks of training, a few years later, people had better function. If a person if a person is not very tech savvy and it's going to be more frustrating, then forget it. But in someone who's looking to say, I'm interested in doing some brain games, that would be the one that would be worth pursuing, because that actually has data to suggest that it could be beneficial. And then recent studies showed even improved cholinergic binding in a brain region important for attention and executive function. And cholinergic binding is reduced with normal aging and dementia. So, this would be the game to pursue. Diet is very important. The MIND diet is a diet that combines the Mediterranean diet and a diet that was developed for people with high blood pressure. And there's nothing too fancy about this diet. It's just obvious one ingredient natural foods. So it emphasizes green leafy vegetables, nuts, berries, olive oil, chicken, fish, beans. And it suggests minimizing red meats, fried foods, pastries, cheese, butter. And people who followed this diet had less cognitive decline over time and less development of Alzheimer's disease and dementia. More specifically, recently, there were studies showing about processed red meat being associated with worse cognition and dementia risk, artificial sweeteners being associated with accelerated cognitive decline, and diet soda associated with higher dementia risk. But on the positive side, another study showed that 2 to 3 cups of caffeinated coffee and 1 to 2 cups of tea both were associated with lower dementia risk. In terms of vitamins and supplements, I mentioned earlier that part of the workup includes lab work, and that includes checking for vitamin deficiencies that are associated with cognitive decline, so that those specific vitamins can be supplemented. So that is recommended, but taking high doses of random individual supplements when you're not deficient has not been proven beneficial. I'll add, in terms of B complex, that's something that tends to be recommended, but in a study looking at people who had like pre-dementia, what we call mild cognitive impairment, in those who had elevated homocysteine levels, again, that's something that the doctor could just check in the blood, B complex has been shown to reduce brain atrophy. So that would be helpful, but again, only in people where there's shown to be a reason where it might be beneficial. In terms of multivitamin, there was an older study found no benefit, but then in 2022, Centrum Silver did a study showing that using their general multivitamin meant for people over 65, there was improvement in cognitive function over 3 years, especially in people with a history of cardiovascular disease. Outside of that, when it comes to all those supplements that say they're for the brain and for memory, none of those are proven yet to be able to say that that's an excellent idea. And it's important to remember that any drug that claims that it could have a positive benefit can certainly cause side effects. And then everything that affects heart health, again, can affect brain health. So it's really important to make sure blood pressure, cholesterol, diabetes, obesity, that all these things are monitored regularly. And if there are conditions that haven't been treated, that they get treated. Sleep is a huge area that's important, quality and quantity. So I think a lot of people have sleep apnea and don't know it. Sleep apnea is a condition that affects sleep quality, and that could have short-term and long-term effects. So in the short term, if a person's not getting good quality sleep, the next day they may have cognitive symptoms, right? Just from that lack of restful and restorative sleep, and they may feel more tired and need naps and be irritable, right? But in the long term, there's terrible effects. Having sleep apnea that's untreated can increase oxidative stress in the brain, promote Alzheimer's disease pathologic changes. During deep sleep, slow wave sleep, that stage of sleep is when the glymphatic system is working. That glymphatic system is our brain's like recycling of toxins. So if you have sleep apnea, you have less of that stage of sleep. And so your brain has less time recycling all those toxins. And so you could get more buildup of those toxins that contribute to Alzheimer's disease and other dementias. There's also been an association of greater white matter disease in people with less slow wave sleep. And then people have sleep apnea sometimes have low oxygen associated with it during sleep. And of course, having a low oxygen level can contribute to dementia through various ways, but oxidative stress and inflammation. It can also increase, again, the white matter disease burden. And moderate and severe severity of sleep apnea has been associated even with microbleeds in the brain. So a person usually doesn't know that they have sleep apnea. Even the bed partner wouldn't necessarily know. And so it's it's pretty easy to get a sleep study with a sleep doctor. And if then you have sleep apnea, that's, treating it would be really important. When it comes to quantity, the goal would be 7 to 8 hours because 6 hours or less has been associated with higher dementia risk.
Oh.
Avoiding substance use or at least minimizing it is also important. So the goal would be no smoking at all, certainly no drugs at all, and actually no alcohol at all. Even light alcohol use, half a drink or one drink a day, has been associated with smaller global brain volume, and that affects both the gray and the white matter. A person who already has dementia, really important to try to prevent accidents because a fall in someone who's already vulnerable, right? Unfortunately, sometimes can be like the beginning of the end. You get broken bone, you have to stay in the hospital, you get delirious, and then your dementia stage may be worse by the time you get out of the hospital. So really important to try to do what you can to prevent accidents. Mood and stress optimization, of course, very important. Depression, anxiety, and stress can all increase the risk of dementia, but in those already affected, of course, can worsen the symptoms. And I'll just mention here, meditation can be helpful for stress reduction. It lowers stress, anxiety, and depression, and can improve focus and memory and psychological well-being. And studies have shown meditation has been associated with altered brain volume and network activity and functional connectivity. And just calming the sympathetic nervous system, so that fight or flight mode, lowering that. Optimizing the senses is, of course, very important. Hearing and vision loss both are risk factors for dementia. And so, recently a study showed that hearing aid use in those who need hearing aids can lower the dementia risk. And of course, if a person isn't hearing what you say, right, you'll think that maybe they didn't remember, but they actually just didn't hear you the first time, right? So that could also not only an overall risk, but could make the symptoms seem worse than they actually are. And a person's using extra mental energy to just have the simple act of hearing, and that increases cognitive load, and so they have less mental energy available to commit what they heard to memory, right? So you're putting more of a strain on the person if they're not using hearing aids if they need them. Toxins, of course, some we can't avoid. California and the wildfires and right, there's certain air pollution that's associated with dementia risk. But in the biotoxin category, for example, recently the shingles vaccine has been shown to be associated with lower dementia risk. Other toxins, like in the metal category or pesticides, right? There's so many different things that have been associated with dementia risk. But the kind of the common pathway for all of these is that they lead to neuroinflammation and oxidative stress that leads to neurodegeneration and dementia pathology. And I kind of went over this a little bit before, but there's in the medication category, there's so many, unfortunately, that are commonly prescribed, which can worsen symptoms. So important to go through the list of medications with your doctor and confirm, that they're all necessary. And if necessary, but it's not the right one, maybe, swap it for one that doesn't have such a risk of worsening cognition. So I'll end with a few take-home points. Dementia is not an inevitable part of the normal aging process. Anyone experiencing cognitive decline should have a comprehensive evaluation to get a specific diagnosis with the goal of looking for reversible causes, identifying causes that are treatable if not reversible, and creating a comprehensive management plan, even if not reversible or treatable, where you optimize safety and quality of life, and to plan ahead. And I just went through over 20 lifestyle, medical, and environmental factors that you can address actively to try to protect and improve brain health. Care coordination is important because there's not just one doctor or a person that could help with dementia evaluation and treatment. A specialist tends to be best suited for the initial comprehensive diagnosis and plan, but so many other types of doctors and care teams are usually required for the ongoing management and all the medical conditions that can affect dementia. And of course, the community resources are so important for the ongoing guidance and support services. So I just have a little page of logo here of, known groups, and little star shout out again to Eliad. Lots of references if anyone is interested. And just thank you again to Emma for inviting me.